I would like to thank the rapporteur, Ms. Lilian Mori-Pasquier, for a truly excellent report. I speak on behalf of the United Left Group in this Parliamentary Assembly, and I would like to start by saying that we fully endorse the report and the draft resolution. Recently, we have been reminded on both sides of the Atlantic how timely this debate is. In Europe, there is a growing concern about the rocketing prices of medicaments, and in the United States, Bernie Sanders, the left-wing candidate for the presidency, and in his wake, Hillary Clinton, put the focus on the necessity to regulate the pharmaceutical industry. Clinton has suggested a ceiling be put on each individual patient's private cost of medicines, about €230 per month. After that, the state should step in with a helping hand. This should hold for medicaments accepted by the health authorities. It struck me how high the suggested ceiling is, or 10 times the ceiling in my own country, Iceland, which many of us regard as being too high. The example used by Sanders and Clinton, and which hit the front page of the New York Times, was a medicine for HIV patients called Daraprim, which had been sold at $13.50 per pill, but after the company came into the hands of speculators under the label Turin Pharmaceuticals, it rocketed to $750 a pill, a rise of 5,500%. This brings to light how exorbitant the prices can get. Of course, this is an extreme example, but nevertheless, it throws light on the dangers when the fate of very ill people is at the mercy of speculators. At a hearing yesterday in the Social Committee via satellite from New York and New Delhi in India, Anand Grover, the former United Nations rapporteur on the right to health, warned against pharmaceutical companies become rent-gathering tools, as he phrased it. This is a concern for patients, the health system at large, and of course for the taxpayer. It is a fragile and difficult discussion, especially where merge the purses of the taxpayer and speculators. I know this well from my own experience as a former Minister of Health. People burdened with difficult health problems often blame the authorities not going along with the demands of the providers of medicines that are seen as saving their lives or making life bearable for them. This is understandable, and indeed, this is understood by companies bent on mobilizing sick people for their own narrow profiteering interest. But we must also remember that the authorities must be careful not to brand everybody as a villain. There are the good and there are the bad. And we all recognize that research and development is necessary, but the cost is often enormous, and accordingly the financial burden of patients, sometimes, not always, through their insurance companies or on the taxpayer, is the case, as is the case in many European countries. And therefore we ask, what is to be done to protect the interests of the payer? More transparency, says this report. But it also says that this is not enough. The pharmaceutical industry has proven that it cannot be self-regulating. Therefore, we need stricter authorization policies, and we need a more formal approach on the interaction between the pharmaceutical industry and health sector stakeholders, and we need more education on all the dimensions involved. Thank you very much.